All right, welcome back to the show. What's best for the patient is best for business. And for what it's worth, I know I've been saying this a lot, but it just seems like all these conversations are really forward thinking and are patient focused and will end up driving business and better numbers for whatever that is. So today will be no different. So welcome, Anik. How are you?
I'm doing great, thank you.
Good. I know I just confirmed how to say your last name. I'm going to let you say it because you say it better than I do.
Yes, my name is Anik Lauzon.
Lauzon. Very good.
Lauzon.
And you are a physical therapist in women's health, and we met maybe a month ago. Yet I thought it was based on some of the things we talked about. I thought it'd be great to get you on the show because, again, I think women's health. If someone said, if someone here's context. If someone came to me today and said, we're going to start a clinic on January 1st and it's December 3rd, I'd say, cool, we're starting a women's health clinic. I wouldn't even ask what they wanted to do. I'd state we're starting a women's health clinic. So I believe it's a big part of our future. A I don't think we serve a lot of people who we could serve. Even probably on this side, we serve even less. Typically, we just talk about MSK, But so all my biases and beliefs around this, and understand why I thought it'd be really valuable to bring you on. So I'm gonna let you share your story, and we'll go from there.
Okay, thank you. So my PT journey started when I was 17 years old after a snowboard accident. Injured my pelvis, my neck, my head, concussion, torn everything. I met an amazing PT who helped me recover almost 100%. And through this experience, I had decided that I wanted to do that as well. I wanted to help people get stronger and just get back to their lives. So that's what brought me into PT in the first place. So for about 7 years, I worked in outpatient clinics with the more typical PT clinic setting. I've seen post-op, orthopedic sports injuries. And then I became a mother and another world opened to me. Um, and through, my own sleep deprivation, postpartum journey, just even during pregnancy, but everything after just changed everything. Like how I saw my own health, wellness, and that's when I truly became interested in women's health because I had definitely something, related to other moms, other women there. But I had decided that it was not only just like the pelvic floor, but women's wellness in general, because I realize women carry so much on their shoulders, and it goes from, you know, physical injuries, recovery, but there's also the emotional component of it, which is also is such a big part of it, but we never talk about it. Um, and then when my daughter was 15 months old, I was in a severe car accident and my world stopped for about 5 months. I was in constant pain, weak, fear, stress, PTSD of, driving, anxiety. And I was not able to be the mother, the caring mother that I used to be. So, um, and COVID hit. So everything was shutting down. I had to do my own PT. My husband is also a physical therapist, so he helped me. But something interesting happened then. Like the pain was fading away. I was getting stronger, but I was still not being myself. There was so much like just stress, fear all the time, the pressure of, being a mom and on top of everything else, my own recovery and pain. So I decided to look into a little more like holistic tools, and that's when I discovered more like breath work, a little like meditation, more yoga based movement, nutrition. and like stress regulation. And that changed everything for me. And I finally started to feel like myself again. So months later, when I went back to work, I promised myself that I would no longer treat my patient just for a specific body part or the pain, but the whole person. And I just slowly I started adding like little tools here and there, and the outcomes were amazing, which led me to open my own mobile concierge physical therapy here in Naples, Florida, where um, I don't have to bill insurance anymore. And I can definitely go a little deeper into that like whole body wellness approach. And to these days, I see probably 90% women, still like 10%, sometimes husbands of clients or things like that, but mostly women. And I treat everyone with this whole body approach. Um, it can look like someone um, is referred for neck pain. And then by asking the right question, I realized that they had previous C-section, um, recent um, hernia repair. And then when you looked at the big picture, you realize, wait, they don't know how to breathe anymore. They don't know how to use their diaphragm. There's like so much scar tissue all over there, and they're tight from the upper trap, and the moderate arthritis that we see on the x-ray, yes, it's there, but now it's just flaring up because they don't know how to breathe anymore. So this is just an example of how we'll treat everything. We'll talk about stress. We will go into deep breathing. We will restore just mobility of the thoracic cage, and then we will talk about the neck. But usually it just it's everything. We have to look at everything. And I'm truly passionate more and more about women's wellness. So about a year ago, I've decided to go even a little deeper and start women's wellness coaching, which is online, and that's where I blend physical therapy concept with pure women wellness for like posture, hormone, nutrition, did I say posture? Lifestyle change. And I'm just on a mission to bridge a gap between physical therapy concept, what we know, all the science, and finally put together all the hormone, nutrition, posture, lifestyle, the hormonal shift, the transition in life all together, so women can finally um, be understood and heal properly while they're being supported physically and emotionally and all of the above. So I'm truly on a mission right now to help connect the dots. And I want to change the standard of care for women because there's a big gap, a really big gap there. Yeah.
So, real quick, the women's wellness, you said you started online. Is that a community for women? Is that education platform for providers? What is that?
This is one-on-one coaching. It's like
Okay,
a
one-on-one
six
coaching.
months wellness package transformation one-on-one with me where we meet once a week. It's not
Okay,
group coaching. It's yeah. Yeah.
cool. Cool. So, yeah, what a journey. And yeah, I like that whole story. It's so interesting. I mean, here we are, right, in December 2025, moving into 26. And, it doesn't matter what you're looking at these days, but understanding, shall we say, the ecosystem that someone
Mm-hmm.
um, moves about in every day of their life, right? Right. Whether
Yeah.
it's, I don't care whether, right. Yet we know, or I'll make a statement and you can correct me if I'm wrong, but that the women's health side of it has been undervalued, underserved, misunderstood, probably not wanting to understand more likely than misunderstood, right? And okay, you had your C-section, okay, we'll give you 6 weeks, and then just go back. And now on top of it, be the mom, like you said, on top of it all, right?
Mm-hmm.
Yeah. So
Yeah.
so that's cool. So well, tell me some of the I think you laid it out, but so what are some of the things you're looking at? Some of the approaches you're looking at to blend all this together. You said it a little bit, but maybe expand on that a little bit more.
Y- I would always start now with like breathing patterns, posture, of course, asking a ton of question and understanding the
Well, right.
lifestyle.
On the
Like,
front end, you're going to ask a ton more questions that
oh
probably aren't
yes.
being asked
Oh
typically
yes.
by, so you just made me think about that. So let me course correct my question.
Yeah.
So even earlier in the journey, you're going to bring people into your world by asking them more questions, more in-depth, holistic questions, probably a good term to say
Mm-hmm.
there,
Mm-hmm. Yep.
regarding everything, right? Regarding
Right.
all aspects of what they're experiencing, all of it. I just, I want to give one quick example of this as I'm unraveling this a little bit. I always use this example with connecting like my front desk work with providers and setting providers up for success. And what example I use every single time is, right, someone, a person, a provider has a postpartum 7:30 low back pain patient, and that's all they know, right?
Mm-hmm.
And
Mm-hmm.
this person has two. They have 7:30 on Tuesday, 7:30 on Wednesday. But then I go through this whole scenario about how different these people are, and none of the information was collected up front to make sure that the provider knew when they walked in the room. And the person who needs it the most and is committing the most and giving up the most to be there ends up dropping off after 3 visits. And then we blame that person for dropping off. Yet it was really on the provider for not fully understanding the story
Mm-hmm.
and the world and whatever we want to call it, the social determinants, whatever we want to call it, all of those things, instead of just sitting across from someone and treating them like a low back pain
Mm-hmm.
patient and them all be the same.
Definitely.
So
Definitely.
that front end and really gathering. And then, what I like about that, as soon as you start that conversation, someone sitting across from you probably within 5 minutes going, this is different in a good way, right? That's a good thing, right? Because
Yes.
what they're saying is, wow, no one has ever asked me these questions. No one has
Correct.
ever cared about this, right? I assume you get that feedback all the time.
Yes. Because we're so used to healthcare system where everything is in compartment, and we have so many specialists, and yet I don't know if the cardiologist really talked to the pulmonologist or they're like we have all these great specialties, but yet it's like the body is not connected.
Yeah, right?
So
Isn't that,
yes, the people are used to go and just sit with the cardiologist and talk about their heart, but there might be so many
God,
other
so
like
many
root
other.
cause to this issue. Same for us in PT, for any body parts actually.
Yeah,
Yeah.
right. It,
So
it has to be for anything, right? Yeah.
yeah, and with the Medicare reimbursement where you cannot treat like two body parts in the same um session, it's just like it doesn't make sense. Like if you have low back pain, maybe it's coming from your ankle. You haven't been walking right for years. Maybe
Yeah,
you just
right.
lack
Right.
dorsiflexion and it changed the whole, kinetic change. And so it's really interesting when you can ask like a ton of questions and just go deeper. It does personalize your session, but yes, the patient will feel like understood, and it does make a difference for sure.
I'm glad you brought that up too. I think that's another important fact for people to think about is people's experience
Mhm.
with it. Because it's always interesting to me. We always ask, "Oh, have you ever been to physical therapy?" And I'm like, "Well, okay, but is
Mhm.
that really the question?" Because people are bringing their experience from healthcare. So they're
Definitely.
bringing their experience with the cardiologist. Let's use your example. They're bringing the experience from the cardiologist. How was that journey for them, right? And we all know that 10 minutes, that 5 minutes with that expert, if you don't set the context and the expectations upstream, like on your website, and I go to your website and I start reading, that it is so important to make sure you're setting expectations around what people should
Mhm.
expect from you. That way, when they call, right? And then you
Yes.
continue that conversation, then they arrive and you deliver on that. They go, that's that whole thing. I always say, whenever a new patient calls to schedule a clinic, if it's managed properly, the only response I want when they hang up is, that was different. I'm like, that's such a win in healthcare, right? That's all I need. I
It
want them to
is.
go to your website and go, that looks different. Then they call you. They hang up. That was different. Then they show up. You continue to deliver on the expectations that were set, and they go,
Mm-hmm.
yeah, I'm in the right place, right? And that's never bought in one moment in time. It's bought over time. And
Mm-hmm.
I assume being a female in this space, that this has been always something I've kind of struggled with. I assume being a female in this space who say, look, I share your experience is pretty powerful too, yeah?
Yeah,
As opposed to
definitely.
sitting across
It
from me.
add Yeah, definitely. Especially, I mean, there's a ton of mothers out there that are carrying the same, emotional load on their shoulders or lack support or whatever it is. But yeah, that definitely adds up for sure.
Yeah.
Um,
Yeah. Yeah. Sorry. Go on.
no, no,
So let's I mean, you can, right, you can take this wherever you want. I'll just keep asking questions. If you stop talking, I'll keep asking questions. And that was the whole idea here. So you're taking more. How long have you been now? So you started your practice though pre-COVID, you said, right?
at that time, I was starting a transition, let's say. I was like
Okay, starting in
part-time with
transition.
my business and part-time in outpatient. Yes.
So there's still been about 5 years. So then unfolding, right?
Yes.
5, 6 years.
Yes.
Cool.
Yeah.
Cool. So now you're at this point of creating this wellness. How old is the women's wellness program?
This
Or
is
what's it
second
called?
year.
What's it called specifically?
It's called Zola Mind Body Wellness.
Cool. Cool. And how long have you been practicing and operating in this capacity?
Only 1 year.
1
1 year.
year.
Yes.
Cool. So how is that coming about? Business is growing. Are you
Business is
sticking to the original
growing, more
plan?
present on social media. Um, and I get to meet people around the world. Uh, But since I still wanna use, like, my PT credential, I
Oh
try
yeah.
to attract, I'm licensed in Florida, so I try to attract people mostly in Florida. So far, it's
Got
been
you.
going pretty well. Um, it's just I cannot go as deep, if it's, someone in other states or
Right.
but in Florida, I'm allowed to do telehealth and just virtually. So I can go a little deeper, talk about their previous aches and pains, accident or whatever, and then add this to the whole transformation for them.
Cool.
Um, yeah.
And
I'm sorry. So recently I had someone who was young, 42 years old, and had a stroke 2 years ago with two young children. And this is just another good example. Still some motor dysfunction, not a ton, but just again going back to a more normal life for her with her children, integrating women's wellness health. It's been really helping her. So it's really interesting to see the progression and how it's helping.
that's cool. So I'm in Los Angeles and my wife has recently found a practice. I mean, it's a primary care practice, right? Within walking distance of where we are. And it's called Tia. I love it, which is aunt, right? In Spanish.
Uh-huh.
And the services, so she came home the first day. I said, so tell me about it, because I wanted to hear about it, right? Because I knew it was for women, right? Run by women. Um, and all the services that they offer is far more than just primary care, right? So it's really nice. It's centered towards women. Again, owned by women, run by women, and all the services available are far beyond just walking into the primary care office. And I really think this is it's going to be a bigger and bigger part of
Hmm.
what comes forward. So
Oh,
tell me, on the platform. So outside of Florida, do you have a community of people you meet with that you, let's say, coach right outside of the PT license, or how are you managing those people outside of Florida? I'm curious.
I've had a few. So I really stay more into like health coaching. I'm also
Yeah.
certified health coach. So I just, no diagnostic, no
Yeah.
specific information. But again, I can help them with nutrition,
Yeah.
lifestyle change. It's just not as specific as with my PT license. Yeah.
So here's a big question. Where do you want to go from here with all of this? Do you want to
Hmm.
grow a network? Do you want to grow with providers? How do you want to grow? Or do you want to grow, I should say?
Yeah, that's a good question.
I'm just
Um,
curious.
hmm I think my goal, since I'm on a mission to change the standard of care for
Yeah.
women, eventually it would be awesome to have maybe a certification for PTs that is not only like pelvic floor, okay, because it's a lot more than just Kegel exercises. um, So other PTs are comfortable discussing real life change and transition for women in different stages of their life, because that's also the thing. You have like before pregnancy, postpartum, that's another. And then you have like midlife, and then you have menopause and postmenopause. And these are all different seasons in women's life where it's all different needs and different
Yeah.
ways to treat, and
Yeah.
the recovery will be different depending on all the hormonal shifts. So I think it would be very interesting to have a big certification that has all of these elements included in. Um, just like we have like sports, orthopedics, performance, like you would have something more for not just pelvic floor, but like women's wellness. I would love to see that. And I will push. I will, like, I'm getting my own business is growing, but I think it would be awesome to um, create a certification like this and maybe do like TEDx talk and promote that women's wellness, and just
Yeah,
the
right. And do all that.
population might be a
Yeah, I would think, Anik, that you have PTs reaching out to you, asking you questions and things like that through your
yeah.
posts and
Yeah, yeah.
everything like that. I would assume that's happening, right?
Yes.
Yeah, I'll tell you why I ask is my brain's already jumping forward like 5 years, right? Fortunately, sorry. Um, because yeah, you create the certification, however you would do
Right.
that and put that together, right? And have your components, have someone get certified, and then they basically come in under, I call it your network, your umbrella, but
Mm-hmm.
your network. And then that way you become the entry point for women across the country
Right.
looking for your solutions. And then you have the providers, right, in
Yeah.
each individual state. And with the compact, right, things are changing too, but you could have providers in
Mm-hmm.
individual states. That way they reach out and you say, great, I have someone for you. And you create that network, right? Because they're
Yeah.
certified. We know that they're going to get that, let's call it that holistic view.
Mm-hmm.
I love the way you talk about that because there, it's all science based. It's all right. It's understanding. You said this, and I love this. Understanding the journey
Mm-hmm.
that someone is on in their lifetime as a woman who's gotten pregnant, who's had a baby, or maybe not the first one, right? Who's had a
Yeah.
baby, and just this continual journey
Mm-hmm.
as they go on and serving them during this journey, not for 6 months, not for 6 weeks, not for just this moment in time. I
Mm-hmm.
love the way you described that when you were talking about that, about how you envisioned it. Um,
Mm-hmm.
because again, I think that's where we have to go as a profession, no matter who we're serving, yet more
Yes.
so, like I said, in the space you're in more than ever, right?
Mm-hmm. Yes. Yeah. And, it would benefit everyone
Yeah, it would.
because if you understand, if we better understand how women's wellness work and how we can be effective with pain recovery and healing, then we have better outcomes. Our clinics are doing better. The healthcare system is doing better.
Is doing better. Well, that's what I was going to say is the healthcare system does better in all this, right? Yeah, ultimately it's about what's best for the patient. And when we do what's best for the person across from us, it should
Hmm.
serve
Yes,
them
definitely.
and keeping them. By the way, I love this because when I think of what you're talking about, you're keeping people out of the current system. So they're not
Hmm.
constantly going back to the doctor. They're not constantly going back for more tests because you're helping them to understand the journey they're on and probably signs and symptoms and what things need to be done and what truly needs to be followed up versus I got to go back to the doctor, right? So yeah, I hear all of that with what you're doing. It's a bigger
And we have,
it's a bigger solution.
yeah. And as physical therapists, we have so much knowledge. We do. We have a ton of knowledge. Where I know, like, we all get like specialized and sometimes in different areas or body parts, but we technically know everything from head to toes. Soft tissue, ligaments, bone, muscle. We know all the insertion, deviation. We're supposed to know all the nerves, the innervation. Um, so we're like the best providers to finally connect the dots all together. And even the population sometimes forget that about like our skills because it's so easy to just say, I'm going to go see my doctor. But we have tremendous skills and knowledge. And we need to emphasize more what we can, how we can help our patient from the mind, from the body, everything. We have the skills. We're right there. We just need to ask the right question and start connecting the dots.
Yeah, I agree. I believe too, Anik, that on top of all that, when you look at the research of what people want from healthcare and what they want from their providers, they don't want to bounce around. They don't want to tell the
Yeah.
same stories. It's in I mean, I've looked all this up. It's consistent. And none of it's a price. So if I go to a group of providers and share with them, right, like what the research says about what people want, everybody in the room would nod their head yes, but no one would be delivering it. So I'd be like, so
Mhm.
why do you keep treating a shoulder, right? Why do you keep treating a pelvic floor?
Right.
So people want it. So
Mm.
I would assume, especially people like women who want to get pregnant, women who are pregnant, women after pregnancy looking for solutions. And right. And so they come across something that says, look, we understand the whole person. We understand the journey you're on, right? They're just going to peak up and there's
Mhm.
no way there's not going to be a huge demand. Again, this is where we started, right? I said I would start a women's health clinic on January 1st, but now I'm going to say a women's wellness clinic, but I'll give you credit for that. Don't worry. Um, because the demand, and even if all people did was reach out to ask more questions, then we're winning,
Mhm.
right? We're winning. And then you get to
Yes.
be the expert. You get to be the resource. I would say the ultimate result we want is to be the resource. When someone
Mhm.
reaches out to you for and respects you enough to ask you that question and then act on your answer when there's no financial interest, when there's no anything, that's the
Mhm.
ultimate, right?
Yeah, I
And
agree.
creating something like that, people are going to say, hey, this is for me, right? This is how. And by the way, it may force them to go to their doctor and ask their doctor better questions. So
Mm.
again, I see this as a huge solution in this approach. And you getting now, Florida's a big state, fortunately. And so you have a lot, but I'm like, but we got to get you out of Florida too, right? We got to get you
Yeah.
across the country,
Yeah, that would be awesome for sure.
right?
Um,
And so people can be helped, let's just say helped wherever they are, right? In that network of people that approach it like you do.
right. I like that word, help. Help and empowered,
Yeah,
um,
empowered, help, educated. We were on a,
educated.
I was on a podcast earlier today and we were talking about RTM, right? Remote therapeutic monitoring. And really someone with a platform, they just keep going. It's just an education. All we're doing is educating. And they said it over and over. So help,
Mhm.
education, empower, right?
Yes,
Those three things are really
definitely.
huge. And if you go to your website, if someone goes to your website and feels they'll get that, then I'm like, and you deliver it, I'm like, it's going to be a successful business, right? No matter where you drop it. And by the way, payer
Right.
model won't matter. All this other shit that people think is so important. It's like, yeah, but if you can't offer those three things, your payer model doesn't matter,
Mm,
right? It doesn't
I
matter.
agree.
In network, out of network cash, it doesn't matter. So
Well,
anything else you're thinking along those lines? Because you got my brain racing, but you, anything else you're thinking along those lines
well,
about the business in the
um,
future?
I have also the honor to be the women's wellness expert on a great company named Lasso Wellness, where
Cool.
we're creating um, like supplements so physical therapists can sell them, recommend them to their patient. So I'll be helping shape the women's wellness brand to help women in different stages of their life, which I'm very excited about. But I think that's exactly where the wellness into the PT clinics is going as well, where we can have discussion with our clients about nutrition, supplements, um, how to improve sleep, recovery, healing, preventing osteoporosis, help with metabolism, losing weight. That's also a big part of wellness, big part of
Yeah,
wellness. So
right. And
excited.
so that's where, right. And that's where we met. And so, I mean, anybody who listens to this podcast is, if they haven't, about 4 episodes ago, I um, talked with all the founders of Lasso Wellness and we talked about all this and what they're growing. So Anik is part of that. I'm part of that from my side of the front end and empowering people, right, within their businesses to be more successful and to create environments that we're talking about, right? And I love the women's health slash wellness side because it's so undervalued, so underserved, yet it still needs to be done everywhere else, right?
Right.
And this whole idea of what we're talking about is people need to come to your website. They're going to be searching for solutions. They need to see your website, regardless of who you are. They need to
Mhm.
see that you are different. And I'm just going to say the word different. We already broke this down. And it
Yeah.
doesn't matter if you're MSK, if you're treating back pain, if you're a sports PT, they're going to need to see you're different. And I believe, based on everything you said, Anik, also, I'll just double down on, we have all this knowledge.
Mhm.
We studied the whole body, right? We dissected from head to toe. We learned the nervous system. We didn't learn just some nerves, right?
Mhm.
And so we are positioned to then leverage that into a bigger picture. And people are going to choose, it's in the research. People want this. They don't want to bounce around. They want
Right.
to find someone they can trust, and then they want that person to be a resource. Now, for you, Anik, right? Whether it's things you do or refer people out, but they want that resource. It's almost, I'm going to say almost like a primary care provider, yet
Mhm.
it's a primary
Oh,
care
yeah.
provider for specific needs and wants,
Yeah.
right? And
Yeah.
so that's where you and I, and why I joined up with Lasso Wellness, is I saw them, understanding the bigger picture of all this. It's not just a product company putting together a platform. I can only imagine all your content on the Lasso
Mhm.
resources
There'll be a
and
lot.
education platform is going to be huge, but it's going
Yeah.
to be huge. And I bet you get more, rightfully so. You're going to have all the visitors. You're going to have more people clicking around because, again, this is so big. So, yeah.
Yeah.
So, I'm glad we met there. And
Yeah. Me too.
that's how I got to meet you. And I wanted to put you on the show. And I think we're going to do good things over there for practice owners in general, right?
Hmm. Yeah. Yes. Yeah. Just looking at the numbers, I know we've talked about numbers before, but it's 65% of PTs are women, and
Yeah, there we go.
like
Yeah.
65% of the patients are women. So that's huge. So for even for male PTs, it's so important to just have basic knowledge in women's wellness in general, And then if you don't feel comfortable like navigating, at least you know what might be wrong, and then you can refer to the right person. But just so this patient can feel understood right away and say, okay, he knows where I have to go now. Yeah, it's huge, huge
Yeah, and
potential.
building up that network of, of knowing those people or knowing what to do next,
Right.
and through learning, right, through what you're sharing and learning more about the questions I should ask earlier on to even know
Hmm.
if the person sitting across from me is in the right place,
Yeah, I agree.
right? That's going to be huge. Yeah, I'm glad you shared that stat. You cut out just a little bit. You said 65% of PTs are women. You said something right after. Is it also patients? 65% of our patients are
These
women.
were
Did
the
you say that?
last numbers I saw. Yeah, around 60% of the
60%.
clients, yeah,
Cool.
patients in PT clinics are women as well. So it's huge,
And then
huge.
everybody will tell you the moms, the mothers, the wives are making the healthcare decisions in the families. So, right. So we can talk
Mhm,
about the majority here, the majority there. And then, when it comes to marketing and sales,
mhm.
regardless of if it's even, right, the
Yes.
woman who needs
Oh,
the
yeah.
services, they're the one making the decisions for the kids. Man, if I had a dollar for every new patient I heard, a new patient call. So I get like I pick up the phone, it'd be a woman, and it's her husband in the background, and she's scheduling PT for her
Yeah,
husband, right? For his low
yeah,
back pain. Or
yeah,
the other way around, I get the husband. I don't know this until they get on the call, but right, I answer the phone. The husband's talking, and he keeps yelling back to his wife for all this. Hey, when did this start, honey? Hey, what's our insurance? Hey, when am I free? Right? It's like,
yeah,
and eventually, half the time, the phone gets handed over. Right? Yeah.
right.
So,
Yeah.
all these important things to remember about who we're serving and who our clients, I don't like to say patients, who our clients and customers
Yeah.
are. Yes, they eventually become patients, but people looking for help. There's a big stat I use in the front of all my talks. Only 10% of the people who can benefit from physical therapy ever get to a physical therapist. So there's so
Wow.
much, right? There's so much, yeah.
Yeah.
And that's been proven over and over. And that number has barely changed since I've been in this
Hmm.
profession.
Yeah.
So
I,
again, this opportunity for you to grow something
yeah.
big and
Big.
significant, I think is so cool. And I didn't mean to put you on the spot with all that, but as soon as you started talking about all this and I was hearing what you're doing, I was like, oh my God,
No, that's a
this
great idea.
huge potential. I call it
Yeah.
huge potential, right?
Mm,
There's potential there, right? It has to be acted upon, but you're still going to do good for a lot of people. Yet anybody, right? Because I would highly assume, like I said, you got people coming in. Hey, I'd love to learn more. Hey, tell me what you're doing, right?
mhm.
Who would love to
Yes.
do the same thing where they are. Yeah,
Yeah. Yeah. But
cool.
community
Yeah.
is a
What
great
else?
idea. I'll keep that in mind. I'll start working
Yeah.
on my
Well,
certification.
yeah. Well, and the Lasso website, that's the cool thing when you read about the
Yeah.
Lasso resources site, right? It's going to
Yeah.
have all that business. There's going to
Yeah.
be marketing, sales, business education there. There's going to
Yeah.
be clinical stuff. But yet again, I think if people show up and see your model, they're going to go, wait, how do I get involved? How do I reproduce this?
Mhm.
Well, the cool thing is there'll be the other resources there to help people. And
Mhm.
then, right, even I think some people on the platform have created certifications
Yeah.
in the past.
Mhm.
So you're fast tracked to creating a
Mhm.
certification for, tell me the business name again. I apologize.
Zola. Zola. Zola.
Yeah, for Zola,
Yeah.
right? Then now you get the inside track on how to create a certification without making all the mistakes someone else
Mm.
made.
Mm.
Yeah, that's great.
Love it.
I didn't mean to put you on the spot, but
No,
this is
no.
cool. This is where it ended up.
It is
Good.
pretty cool. Yes.
Well, I think it's a huge solution. It's a huge solution you're offering, and I love the way you explained it, and put it out there about the journey that someone is on, and that's the other thing I've talked about a lot is I always say when you pick up the phone and someone says, hi, my name is, and I want to get scheduled for this, I'm like, they're on a journey. They called you at a point in a journey,
Mhm.
and we
Definitely.
don't have to learn the whole journey per se, but we better at that moment in time start learning where they are in that journey, right? And
Yes.
kind of what led up to this and where do you want to go on this journey? And right, a lot of the things that you probably ask people, hey, how many kids?
Hmm.
Hey, when did this start? Hey, what's been going on? Hey, right, all this other stuff.
Yeah.
Yeah,
Yes.
this is cool.
Definitely. Everyone's on a journey. Everyone has a story to tell.
Absolutely
And
everybody, right?
there's
And we
something
don't
that
do
I
a good
like.
enough. Yeah,
Oh, no, no, keep
go.
going. I was
Nope,
gonna
you
say,
go.
the body, um, oh, I can't remember what it is.
Well, I've heard
It's
a
a
quote
saying.
before.
It
It's like
says,
the body never forgets, right?
"Never forgets." It's like your body screams before your mind can understand what's going on.
Yeah, right.
It's
There you
like
go. So
you'll
right, yeah,
feel
it's
the
always
aches
like,
and
yeah,
pains before you can
right.
like you can start to understand why it happened. So you
Oh,
better,
absolutely.
as therapists, we better ask questions to figure it out.
There we go. There we go. And I think going to chime in and go and do it earlier in their journey. So again, make sure they see it on
Mm,
your website, make sure they hear it on the first phone call. And then all you got to do is deliver, right? There's no over delivering and there's no exceeding expectations. I'm like, people always talk about, oh, you got to exceed expectations. I'm like, have you ever been in healthcare? You just got to make a promise and deliver on it. That
right,
that that's all you got to do. That's all
right.
people want from us.
Yeah.
Tell me what's going to happen next and then fucking deliver. I curse a lot and I have to curse on these so I get my E on every episode. But right, we make it
Yeah.
so hard. We put it all on the provider to do all that. I'm like, no, do a little work beforehand. And when they walk in the room and see Dr. Anik, they're going to expect what they were told you're going to do. And then you do it. And I'm like,
Yeah.
we all win, right? Patient
Hmm.
wins, business wins, provider wins, everybody wins.
Yeah. Fully agree.
Yeah, that's cool. You'll build this all into the certification program anyway.
Hmm. Yes, I will.
That's awesome. All right. I appreciate the conversation, Anik. I appreciate you being open to all these questions about the future, and talking about that. And I am going to get a shout out that people are going to have a great place to come see you and your content and learn all about this stuff on the Lasso resource site. So when that thing drops, I'll make sure everybody knows. But I have a feeling you're going to be getting all the hits over there. So that's a great thing. So thank you.
Thank you. Thank you for having me. It's been fun.
Cool.
Thank you.
All right.